I received report from the night shift nurse about my patient who was 24 hours postpartum and was having trouble being independent with her care, refusing pain medications, and not really engaging in the care of her newborn. When I entered the room, the patient seemed very flat. I'm not really engaging in conversation and not answering the questions that I was asking her. I tried to be encouraging and set goals. I tried to tell her that our goals were going to be to kind of be independent. I wanted her to ambulate and walk around. I wanted her to take her pain medications so she could feel better. And I wanted her to participate in the care of her newborn. She quickly shut me down and said that she already knew what she had to do, and everybody kept bothering her, and all she wanted to do was sleep. I began to feel overwhelmed about how the rest of the shift was going to go. And then that meant that if she wasn't participating in her care, she was going to stay longer in the hospital, and I was concerned about the care of her newborn. My amygdala quickly began to take over, and I began thinking about what was I going to say next that wasn't going to come off as pushing or overbearing. So I took a deep breath, and I lowered my voice, and I sat down next to her, and I asked her to tell me how she really was feeling physically and emotionally. She admitted that she was scared, she was in pain, and that she had anxiety about going home. We talked about it. We set goals. I explained what the postpartum recovery was going to be like and the resources available. She was thankful that I took a second to accommodate to her needs and listen to her concerns. And I think what helped bring my amygdala down was to take a deep breath and put myself in her position and how overwhelming having a newborn and being postpartum can be.